All right, get ready to dive in. You've given us a ton of material on the cardiovascular system, so it's pretty clear you want to go deep on this one.
Yeah, we're talking images, text, all sorts of stuff, really focusing on the heart and what keeps it going strong.
Exactly. And whether you're studying for a big exam, getting ready for a career in cardiology, or just fascinated by the heart, think of this as your crash course in all things cardiovascular.
Absolutely. It's not just about memorizing facts and figures, though. This is about understanding how it all works together to keep your heart pumping at its best.
For sure. We'll cover it all. From the basics of keeping that blood flowing to what happens when things go wrong, like in a situation like shock. Oh, and get ready to tackle the so-called silent killer, hypertension, and that all too common heart failure.
What I find so fascinating is how everything is connected. It's like a complex web, but once you grasp the basic principles, the whole system starts to make sense.
Right. So speaking of basic principles, one thing that really jumped out from all this material was this idea that there are three main factors that determine whether our blood pressure stays where it needs to be. A working pump, that's your heart, of course, enough fluid volume, and the right amount of resistance in those blood vessels.
Yeah, those three things work together in harmony to keep your blood moving effectively. If one of them gets out of whack, that's when we start to see problems.
Makes sense. And the material pointed out that most heart problems stem from issues with either the heart's electrical system, how much fluid it's dealing with, or the muscle's ability to contract. It really is like a finely tuned machine. Any little glitch can throw off the whole system.
Right. And a good way to understand how those glitches affect a person is to look at the New York Heart Association functional classification system. It categorizes heart failure into four classes based on how much it limits someone's ability to be physically active.
So class I is like, hey, I'm good, no limitations. While class 4 is a lot more serious.
Exactly. Class I means you can handle everyday activities without any issues. But as you move up the classes, the limitations get more and more significant. Picture getting out of breath just walking to the mailbox. That might be class 3. Class 4 individuals might have symptoms even when they're resting, making simple tasks a challenge.
Wow, that really puts things into perspective. It's a good reminder of how important our cardiovascular health is for every aspect of our lives. But let's shift gears for a minute and talk about a situation where things get really dangerous. Shock. The material really highlighted how critical this is, and honestly, it's kind of scary.
It is scary, and for good reason. Shock happens when the cardiovascular system fails so badly that your organs don't get the oxygen-rich blood they need to function. Imagine your delivery system breaking down. Without those vital supplies, things start shutting down and fast.
And it's crazy how many different things can trigger it. Hemorrhage, heart attacks, pulmonary embolisms, even allergic reactions or spinal cord injuries. It's amazing how all those diverse things can all lead to this one life-threatening condition.
It all comes back to how interconnected the system is, and how a problem in one area can create a ripple effect through the whole thing. We can actually group shock into different types based on the cause. There's hypovolemic shock, which is a loss of blood volume. Think of a major bleeding event. Then there's cardiogenic shock, which is where the heart itself isn't pumping effectively. It's like the engine sputtering out, maybe from a heart attack or a problem with a valve.
Then we have obstructive shock, where something's physically blocking blood flow like a big blood clot in the lungs. And then there's distributive shock, where blood vessels get too wide, causing blood pressure to plummet. That can happen in sepsis, anaphylaxis, or even spinal cord injuries.
You got it. And while the causes are different, the body's response to shock is generally pretty consistent. It releases hormones like adrenaline to try to compensate and raise blood pressure. But those are just temporary fixes. If you don't deal with the underlying cause, the situation keeps getting worse.
So how do we recognize shock before it's too late? Are there any signs we should be looking for?
Definitely. One key indicator is a sudden drop in blood pressure. But you have to remember, it's more about the change in blood pressure than the actual number. Someone with normally low blood pressure might be fine at a level that would indicate shock for someone else. Other classic signs include a fast heart rate, confusion, and cold hands and feet.
So if you see someone getting disoriented, their heart is racing, and their hands and feet are ice cold, those are big red flags.
Absolutely. And in those situations, every second counts. Calling for help immediately can make all the difference.
No kidding. Speaking of diagnosis, the source material mentioned that measuring lactate levels is super important when someone's in shock. Why is that so crucial?
Well, lactate is a byproduct of what we call anaerobic metabolism. Think of it as the body's backup energy system when there's not enough oxygen available. High lactate levels, especially a condition called lactic acidosis, tell us that the tissues aren't getting enough oxygen, which is a hallmark of shock.
It's like an alarm bell going off, signaling a major oxygen problem. And they use a bunch of other tests too, like blood counts, blood chemistry, blood gases, and ECGs.
Exactly. It's about getting a full picture of what's happening. Treatment has to be fast and on multiple fronts. We need to address both the root cause and the symptoms, making sure the patient can breathe, their heart's beating, and their circulation is supported, all while tackling the underlying problem.
That's intense. Thankfully, the next condition we're going to talk about is a bit less dramatic, although it can still be a big deal, especially for our older listeners. We're talking about orthostasis, or postural hypotension.
Right. That's just a fancy way of saying your blood pressure drops significantly when you stand up. It may not sound like a big deal, but it can lead to dizziness, lightheadedness, and even fainting, which can increase the risk of falls, especially in older folks.
So someone might feel like the room is spinning when they stand up too quickly?
Exactly, and there are a lot of different causes, ranging from something as simple as dehydration or medication side effects to more serious issues like heart problems or neurological disorders.
So if this is happening regularly, it's probably worth checking with a doctor to rule out anything serious.
Definitely. Better safe than sorry. And speaking of conditions that warrant a trip to the doctor, let's move on to what some people call the silent killer, hypertension or high blood pressure.
This is where it gets really interesting and kind of scary. The source material really emphasized that high blood pressure often doesn't have any noticeable symptoms until it's already causing damage to other organs. It's like a ticking time bomb.
That's why regular checkups are so important. You could have high blood pressure for years and not know it, putting you at risk for heart attacks, strokes, and kidney problems. The key is prevention and early detection.
So how do you even know if you have high blood pressure? What numbers should we be watching out for?
Well, first, we need to make a distinction between primary and secondary hypertension. Primary hypertension, which is also called essential hypertension, is the most common type, and it doesn't have one single cause. It's more like a combination of risk factors like genetics, age, and lifestyle choices. Things like high salt intake, being overweight, and not getting enough exercise.
And secondary hypertension is caused by another medical condition, like kidney disease or a hormonal problem, right?
Right. Now, to answer your question about the numbers, the guidelines have actually changed in recent years. We used to say that 1490 millimeter Hg or higher was the cutoff for hypertension, but now it's anything over 2080 millimeter Hg.
Hold on, so they've lowered the bar.
They have, and that's because research has shown that even slightly elevated blood pressure increases your risk of cardiovascular disease. So we now consider 120, 129 systolic over less than 80 diastolic to be elevated blood pressure. 130, 139 systolic or 80, 89 diastolic is stage 1 hypertension, and anything 420, 90 or higher is stage 2.
Wow, I had no idea. So that means a lot more people might have high blood pressure and not even realize it.
Exactly. That's why awareness and regular checkups are so important.
I'm definitely making an appointment soon. The source material also talked about hypertensive emergencies, where blood pressure readings are over 180 systolic or over 120 diastolic. They listed some really scary potential complications, like stroke and even aortic dissection.
Those are absolutely life-threatening situations that need immediate medical attention. There's no question about it. If you ever experience a sudden, severe spike in blood pressure, you need to call 911.
I'll definitely keep that in mind.
Yeah.
Okay, so let's say someone is diagnosed with hypertension. What's next? Are they going to have to take medication for the rest of their lives?
Not necessarily, especially if it's essential hypertension. The first line of defense is usually lifestyle changes.
So all those things we hear about, healthy diet, regular exercise, maintaining a healthy weight, they actually make a real difference.
They absolutely do. In fact, there's a diet called the DAS diet, which stands for Dietary Approaches to Stop Hypertension, that can be super effective. It focuses on eating lots of fruits, veggies, whole grains, and lean proteins while cutting back on things like saturated fat, cholesterol, and sodium.
And I'm guessing quitting smoking and cutting back on alcohol are part of the equation too, right?
For sure. Those are essential for good cardiovascular health overall. Now, if lifestyle changes alone aren't enough to get blood pressure down to a healthy level, that's when medication might be needed.
And there are a ton of different types of blood pressure medications out there, right?
You're telling me. We have diuretics, which help the kidneys get rid of excess fluid and salt, beta blockers, which slow down the heart rate and reduce how hard the heart has to work, ACE inhibitors, and ARBs, which relax blood vessels. The list goes on and on.
It's like a toolbox with different tools for different jobs.
Exactly. The choice of medication really depends on each person's individual needs and medical history. It's not a one-size-fits-all approach.
So working closely with your doctor is key. They can help you figure out the best strategy to manage your hypertension.
Precisely. It's a partnership, and it requires open communication and a shared commitment to reaching those blood pressure goals.
Okay, so we've tackled the basics of hypertension.
Mm-hmm.
Let's move on to another big one, and unfortunately, a condition that's becoming more common these days: heart failure.
Heart failure, or HF, is when the heart just can't pump enough blood to meet the body's needs. It's like a pump that's losing its power, and it can affect either the left side of the heart, the right side, or both.
And this is something we're seeing more and more as people get older, right?
Unfortunately, yes, it's a major public health concern. Now, the symptoms of heart failure can be different depending on which side of the heart is affected.
So with left-sided HS, fluid backs up into the lungs, which causes shortness of breath, fatigue, and sometimes even coughing up pinkish, brothy sputum because there's blood mixing in with that fluid. And with right-sided HF, the fluid backs up into the body, which causes swelling in the legs and abdomen.
Exactly. It all depends on where the backup is happening and how that impacts different parts of the body.
I'm noticing a pattern here. A lot of these conditions seem to involve fluid building up somewhere.
You're picking up on a key theme here. Fluid balance is a huge deal in cardiovascular health. To diagnose heart failure, doctors use a combination of things: a physical exam, chest x-rays, ECGs, and often an echocardiogram, which uses sound waves to create pictures of the heart.
It's like a sonogram for your heart. And it looks like treatment, once again, starts with those lifestyle changes: losing weight, exercising more, and eating a low-sodium diet.
You got it. But often, medication is necessary too. We use diuretics to reduce fluid buildup, ACE inhibitors to improve blood flow, and beta blockers to lighten the heart's workload.
It's amazing how many of these conditions come back to lifestyle choices and how making even small changes can have a big impact.
It really highlights how much power we have over our own cardiovascular health. Even if you don't have a specific condition, taking steps to live a heart-healthy lifestyle is the best thing you can do for yourself.
Okay, before we jump into specific types of heart disease, let's talk about a condition that often lays the groundwork for a lot of them. Atherosclerosis.
Atherosclerosis.
Yeah.
This is where plaque, which is made up of fat, cholesterol, and other substances, builds up inside the walls of the arteries. Imagine your arteries like pipes. Over time, that plaque can clog them up, restricting blood flow.
So it's like the plumbing system for your heart, and if the pipes get too clogged, you're going to have problems.
Exactly. Atherosclerosis is a major contributor to heart attacks, strokes, and peripheral artery disease.
And, surprise, surprise, lifestyle factors play a huge role here too. Smoking, high cholesterol, lack of exercise, they all contribute to that plaque buildup.
Absolutely. That's why prevention is so crucial. Quitting smoking, managing your blood pressure and cholesterol, and making heart-healthy lifestyle choices can significantly lower your risk.
It's all about being proactive. So now let's switch gears and talk about ischemic heart disease. What exactly is going on there?
Ischemic heart disease is when the heart muscle isn't getting enough oxygen. And usually the culprit is, you guessed it, atherosclerosis. Those narrowed arteries can't deliver enough oxygen-rich blood to keep the heart happy.
And yet again, all those usual suspects: age, family history, smoking, obesity, diabetes, hypertension. They're all risk factors for this one too.
You got it. And there's another factor you may not have heard of: metabolic syndrome.
Okay, what is that exactly?
It's a group of conditions that tend to occur together: high blood pressure, high blood sugar, excess belly fat, and abnormal cholesterol levels. Having this combination really ups your risk of heart disease, stroke, and type 2 diabetes.
Yikes. So they're all teaming up on your heart.
That's one way to put it. Now, within ischemic heart disease, we have two main types: stable angina and unstable angina.
So stable angina is that classic chest pain that happens when you exert yourself and goes away when you rest. It's like your heart saying, hey, I need a break. And unstable angina is chest pain that happens even when you're resting, and it can be a warning sign of a possible heart attack.
Exactly. It's like your heart is sending you an urgent message. Something's wrong, go to the hospital. To diagnose these conditions, doctors might use an EKG, a stress test, an echocardiogram, or even a coronary angiography.
My coronary angiography is a more invasive procedure where they inject dye into the arteries and take x-rays to see exactly what's going on, right?
Right. It gives them a clear picture of what's happening in the coronary arteries. Now, when it comes to serious heart problems, we have to talk about acute coronary syndromes, or ACS.
And this is where things get really serious, right? We're talking heart attack.
Yes. ACS is an umbrella term that includes unstable angina, non-ST elevation myocardial infarction, or NSTEMI, and the big one, ST elevation myocardial infarction, or STEMI, which is the classic heart attack.
And STEMI is caused by complete blockage of coronary artery. No blood flow, big problem.
Exactly. And while the classic symptom is crushing chest pain, it's not always so dramatic. Some people, especially women, have less intense pain or even just nausea, sweating, and shortness of breath.
So it's really important to be aware of all the possible warning signs and not just wait for that classic Hollywood heart attack scene.
Absolutely. The faster you get help, the better the outcome is likely to be. The EKG is our best friend when it comes to diagnosing ACS.
Because it can show those telltale ST segment elevations that indicate a STEMI.
You got it. And we also use blood tests to look for cardiac biomarkers, specifically troponin, which is a protein that gets released when heart muscle is damaged.
So if someone comes to the ER with chest pain, the EKG and troponin levels can help determine if they're having a heart attack and what kind it is.
Exactly. Treatment for ACS needs to be fast and aggressive. We give aspirin immediately to prevent further clotting, nitroglycerin to widen blood vessels and improve blood flow. And for STEMI, we aim for what's called reperfusion therapy.
And reperfusion therapy means opening up that blocked artery, either with angioplasty and stenting or by using clot-busting drugs.
Exactly. Time is muscle when it comes to heart attacks. The sooner we can restore blood flow, the less damage there will be to the heart.
I'm sensing a theme here. Time is of the essence for so many of these cardiovascular emergencies.
You're absolutely right. Early recognition and intervention can be life-saving. Speaking of early intervention, let's switch gears to congenital heart anomalies, problems that are present at birth.
Right. These are structural issues with the heart, and they can range from minor to life-threatening.
Exactly. And we group them into two main categories, cyanotic and acyanotic.
So cyanotic refers to conditions that cause a bluish tint to the skin, lips, and nail beds because there's not enough oxygen in the blood. This is often caused by a right-to-left shunt, meaning blood bypasses the lungs and doesn't pick up enough oxygen.
That's a great explanation. Tetralogy of Fallot is a classic example of a cyanotic heart defect. It involves 4 specific defects that disrupt blood flow through the heart and lungs.
And then acyanotic defects don't cause that bluish discoloration. Examples include atrial septal defects, ventricular septal defects, and patent ductus arteriosus.
Right. These can involve holes in the walls separating the heart chambers, or a blood vessel that didn't close properly after birth. They might not cause problems right away, but they can lead to complications later on.
And it looks like echocardiography is the go-to tool for diagnosing these defects.
It is. Echocardiography lets us see the heart's structure and how it's functioning in detail. And depending on the severity of the defect, surgery might be necessary.
Wow, we've covered a lot of ground already. But we're not done yet. Let's move on to another major category of heart problems, valvular heart disease.
Valvular heart disease is any condition that affects the heart valves, those little doors that control the flow of blood through the heart.
And the most common problems are stenosis, which means the valve is narrowed and doesn't open all the way, and insufficiency or regurgitation, which means the valve doesn't close tightly and allows blood to leak backward.
You got it. And the valves that are most commonly affected are the aortic and mitral valves.
The source material mentions that doctors use the location, intensity, quality, and timing of heart murmurs to diagnose specific valve disorders.
Think of a heart murmur as an extra sound you hear during the heartbeat, like a whooshing or swishing sound. It can tell us a lot about how well the valves are working.
So it's like listening for clues in a mystery novel. The symptoms of valvular heart disease seem to range from simple fatigue and shortness of breath to chest pain and even fainting.
Yeah, it all depends on which valve is affected and how bad the problem is.
It looks like they usually diagnose it with an echocardiogram, and sometimes they do a cardiac catheterization, which is where they thread a thin tube into a blood vessel and guide it to the heart.
Exactly. That lets us get a really good look at the valves and see how damaged they are.
And then treatment can involve anything from medication to manage symptoms to surgical repair or replacement of the damaged valve.
You got it. It all depends on the individual case. But the good news is we have a lot of options for treating valvular heart disease.
That's good to hear. Okay, we've talked about problems with the aortic and mitral valves. What about the tricuspid and pulmonary valves? Do they cause problems too?
They can, although problems with these valves are less common. The tricuspid valve controls blood flow between the right atrium and ventricle, and the pulmonary valve controls flow between the right ventricle and the lungs.
And stenosis, that narrowing we talked about earlier, is the main problem with these valves, often caused by rheumatic fever or congenital defects.
That's right. Doctors use those telltale heart murmurs, along with other clinical findings, to diagnose the problem. And treatment can range from medication to surgery, depending on how severe it is.
It's amazing how much we've covered already, and we're not even close to being done. It's like a whole new world has opened up to me, the intricacies of this incredible system.
And we're just getting started. Next, we're going to explore those fascinating rate and rhythm disorders, the problems with the heart's electrical system that can cause everything from harmless palpitations to life-threatening arrhythmias.
Things are about to get electric. Stay tuned for part 2, where we'll unravel the complexities of the heart's rhythm and how it can go wrong. Welcome back. I hope you're ready for round 2 because we're about to get into the fascinating world of the heart's electrical system and all those rhythms that can make it skip a beat, literally.
We covered some pretty intense stuff last time, but now it's time to get electric.
You got it. But before we get into all that, we have to talk about the incredible network of blood vessels that carry oxygen-rich blood throughout the body. We're going to explore what happens when those pathways get messed up, starting with something called peripheral arterial disease, or PAD.
Right, it's all connected, and just as important as a strong heart muscle is a healthy vascular system, those blood vessels that act like highways transporting blood throughout your body.
From what I'm seeing in these sources, PAD is kind of like atherosclerosis, but instead of affecting the arteries that supply the heart, it hits the ones in the legs. It's that same plaque buildup narrowing the arteries and basically creating a traffic jam for blood flow.
You nailed it. And just like atherosclerosis in the heart, PID can be pretty sneaky, often not causing any noticeable symptoms until it's progressed to a more advanced stage.
So someone might not even know they have it until they start feeling pain in their legs when they walk. The sources mention something called intermittent claudication.
Exactly. Intermittent claudication is a cramping, aching, or fatigue in the legs or calves that comes on during physical activity and goes away with rest. It's a classic sign of PA, and it's basically your muscles saying, hey, we need more oxygen down here.
So it's a pretty clear sign that something's not right.
It is, and ignoring it can lead to some serious problems. PA can progress to the point where you have pain even at rest, ulcers that don't heal, and in severe cases, even gangrene.
Okay, that's definitely not something I want to mess with. So it sounds as early diagnosis and treatment are really important for PA.
Absolutely. The good news is that a lot of the same lifestyle changes that are good for your heart can also help prevent PAD. Quitting smoking, managing your diabetes, keeping your blood pressure and cholesterol under control, all those things benefit both your heart and your legs.
It really is all connected. The sources mention a couple of tests doctors use to diagnose PAD, like the ankle brachial index or ABI.
Right. The ABI is a simple test that compares the blood pressure in your ankles to the blood pressure in your arms. It's a quick and easy way to see how wide the blood is flowing in your legs.
And then there's angiography, which is where they inject dye into the arteries and use x-rays to see where the blockages are.
Exactly. Angiography gives doctors a detailed roadmap of the arteries in the legs, showing them exactly where those blockages are. Once PA is diagnosed, the goal of treatment is to restore blood flow to the legs and relieve those symptoms. Medications to prevent blood clots, lower blood pressure, and manage cholesterol are often part of the treatment plan.
And in some cases, they might even do surgery, like angioplasty or bypass surgery, to create detours around those blockages.
That's right, it's all about getting that blood flowing again. Now, let's switch gears and talk about a condition that's less serious, but still pretty common and can be uncomfortable. Varicose veins. Those are those twisted, bulging veins you often see in people's legs.
Ah, yes, those. Not exactly a fashion statement, but are they anything more than just a cosmetic problem?
Well, for some folks, they're mainly a cosmetic issue, but varicose veins can definitely cause discomfort, aching, pain, swelling, even skin ulcers if they're not treated. They happen when the valves in the veins, those little one-way doors that help keep blood flowing back to the heart, get weak and allow blood to pool.
I can almost feel the pressure building just thinking about it. The sources talk about using duplex ultrasound to find those leaky valves, and it seems like treatment can range from compression stockings to lifestyle changes and minimally invasive procedures.
Right. Compression stockings gently squeeze the veins, which helps push the blood back towards the heart. And simple lifestyle changes, like maintaining a healthy weight, exercising regularly, and avoiding standing or sitting for long periods of time, can also make a difference.
And then there are those minimally invasive procedures that use lasers or radiofrequency energy to close off the problematic veins.
Exactly. Now, let's shift our attention to a couple of conditions that involve unwelcome guests in our veins: blood clots. We're talking about thrombophlebitis and deep vein thrombosis, or DVT.
So thrombophlebitis is an inflamed vein, often with a blood clot, and DVT is a clot that forms in a deep vein, usually in the legs.
You got it. And while thrombophlebitis can be painful and annoying, DVT can be a lot more serious. That's because the clot can break loose, travel through the bloodstream, and lodge in the lungs, which is called a pulmonary embolism, and that can be life-threatening.
Oh wow, that took a serious turn.
It can happen fast. It's super important to know the signs of DVT pain, swelling, and redness in the affected leg, and get medical attention right away if you think you might have it.
So that trusty duplex ultrasound is our friend again when it comes to diagnosis. What about treatment?
Treatment for DVT usually involves taking anticoagulants, which are also called blood thinners. These medications help prevent the clot from getting bigger and reduce the risk of it breaking off. Sometimes they might even use clot-busting medications to try to dissolve the clot faster.
It's like they're waging war on those clots. Now, the source material also mentions chronic venous insufficiency, which is basically long-term damage to the veins that makes it hard for blood to flow back to the heart.
Right. Think of it as the aftermath of those vein battles. It often happens as a complication of DVT or varicose veins, and it can cause persistent swelling, changes in the skin, and ulcers.
So those veins are kind of like battle-scarred from dealing with those clots.
Hmm.
And treatment is all about managing those lingering symptoms.
Exactly. Things like compression therapy, elevating your legs, and taking good care of any wounds are the mainstays of treatment.
Okay, let's move on to a condition that's not as common but can be very serious: giant cell arteritis.
The sources describe this as an inflammatory condition that affects the arteries, especially the temporal artery, which runs along the side of the head. It's an autoimmune disease where the body's immune system is basically attacking its own blood vessels, right?
That's exactly right. It's like friendly fire within the immune system. And it can cause some serious problems. Headache, jaw pain, and tenderness over the temporal artery are the most common symptoms. But what's really worrisome is that it can cause vision loss if it's not treated.
That's scary. It sounds like early detection is super important with this one.
It is. Doctors will often do a biopsy of the temporal artery to confirm the diagnosis. The good news is that treatment with high-dose steroids can really help reduce the inflammation and prevent vision loss. It's amazing how powerful steroids can be, both the good and the bad. Now, before we wrap up this part of our cardiovascular adventure, let's talk about another condition that's often called a silent killer: aortic aneurysms.
Aortic aneurysms are bulges that form in the wall of the aorta, which is the major artery that carries blood from the heart to the rest of the body. Imagine you have a garden hose with a weak spot that balloons outward. That's basically what happens in an aneurysm.
And the danger is that these bulges can rupture, causing massive internal bleeding, right?
That's right. And what makes them so scary is that they often don't cause any symptoms at all, hence the nickname silent killer.
So how do you even know if you have one?
That's where screening comes in. A simple ultrasound of the abdomen can detect these bulges in the abdominal aorta, which is where they most commonly occur.
It's like a sonar for your aorta. So once an aneurysm is found, what happens then?
Well, it depends on how big the aneurysm is and how fast it's growing. If it's small, they might just watch it with regular imaging. But if it's large or growing quickly, they might need to do surgery to repair it.
And there are two main types of repair, right? Open surgery, which involves a big incision in the abdomen, and endovascular repair, which is less invasive and involves inserting a stent graft through a catheter in the groin.
Exactly. The type of procedure depends on the individual case and the specifics of the aneurysm, but the goal is always the same: to prevent that bulge from rupturing.
We've covered so much ground in this deep dive. It's amazing how many different things can affect this one system that's so essential for life.
It really is a complex and delicate system, but understanding how it works helps us take better care of it.
Absolutely. Stay tuned for the final part of our deep dive, where we'll shift gears from specific conditions to what all of this means for you and your own heart health. And we're back for the final part of our cardiovascular deep dive, We've explored the heart's intricate pathways, delved into a whole bunch of different conditions, and even encountered some of those so-called silent killers lurking in the shadows. But now it's time to bring it all home. What does all this information mean for your heart health?
That's the big question, isn't it? And if we take a step back and look at the big picture, I think a major takeaway from our journey is the importance of prevention. We've seen how so many of these conditions share common risk factors, and a lot of those are things you can actually control.
It's like that same old song and dance, right? Smoking, high blood pressure, diabetes, obesity, high cholesterol. Those culprits just keep popping up over and over again.
Exactly. But here's the good news. Those are all things you can change. They're modifiable risk factors, which means you have the power to change the story. Even small changes, if you do them consistently, can make a huge difference for your heart health in the long run.
So all those things we always hear about, quitting smoking, eating a healthy diet, getting regular exercise, maintaining a healthy weight, they really do matter.
They're not just empty words. Those lifestyle choices are your first line of defense against a whole range of cardiovascular problems. It's also crucial to know your numbers, things like your blood pressure, cholesterol levels, and blood sugar. Regular checkups are so important, and don't be afraid to talk to your doctor about any concerns you have, even if they seem small.
And if you're already managing a condition, like high blood pressure or diabetes, it's super important to stick to your treatment plan.
It's like having a roadmap to a healthier heart. You don't want to veer off course.
That's a great way to put it.
Yeah.
And speaking of roadmaps, if you have a family history of cardiovascular disease, that's another reason to be proactive about your health.
Yeah, it's like inheriting a predisposition, right? But it doesn't mean your fate is sealed. Knowledge is power.
Right. Knowing your family history allows you and your doctor to be more vigilant and take steps to reduce your risk. They might recommend getting screened more often or even doing genetic testing to get a better understanding of your risk factors.
Absolutely. And it's amazing how much progress we've made in understanding how genetics and lifestyle interact to influence heart health.
It really is. And all that knowledge puts us in a better position to make informed decisions that can actually change our future health outcomes.
It's all about taking ownership of your health.
Well said. It's been an amazing journey exploring the world of the cardiovascular system. We've seen how complex it is, explored its vulnerabilities, and marveled at how resilient it can be.
And I hope you've learned a lot, not just facts and figures, but also a sense of empowerment when it comes to your own heart health. You have more control than you might think to keep your heart healthy and live a longer, healthier life.
This deep dive has been a real eye-opener. So, as we wrap up, here's a final thought for you to consider. What's one action, no matter how small, that you can take today to make your cardiovascular health a priority? Will you go for a walk, schedule that doctor's appointment you've been putting off, or swap that sugary snack for something a little bit healthier?
Every step you take, no matter how small, brings you closer to a healthier heart.
So true. Thanks for joining us on this incredible journey. Until next time, stay curious, stay informed, and keep your heart healthy.